Welcome to your guide to liposuction. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. Many people seek liposuction because they want to improve the contours of their body and remove fat from specific areas, including hips, buttocks, thighs, neck, arms, chest, and abdomen. Liposuction is frequently combined with other body contouring procedures, such as a tummy tuck. The best candidate for this procedure is a physically healthy, normal weight person with firm, elastic skin and with realistic goals and expectations. Procedure: how will your liposuction be performed? Liposuction is typically performed on an outpatient basis. There are a number of liposuction techniques that can be utilized to tailor your procedure to your specific needs, such as tumescent liposuction. Using a mixture of local anesthetic and adrenaline, a special solution called tumescent fluid is created. This fluid is inserted into the treated areas through tiny access points. It helps numb the treated area, controls bleeding, and reacts with your fat, making it easier to remove. The fat is then suctioned out through a blunt tubular instrument called a cannula. Power-assisted liposuction, PAL. The PAL procedure is very similar to tumescent liposuction, except that a powered mechanized cannula is used. Ultrasound-assisted liposuction, UAL. The UAL technique uses ultrasound energy to literally melt your fat. Tumescent fluid is first injected, and then special probes that emit ultrasound energy react with the fat to liquefy it. The liquefied fat is then suctioned out through tiny incisions using a cannula. Laser-assisted liposuction, LAL. A small laser is inserted through a small incision to deliver low-energy waves to liquefy fat in targeted areas. The fat is then suctioned out with a cannula. Together, we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Preparation. Every person has a unique perspective on beauty, and your goals will affect the way your surgery is performed. It is important to discuss your desires and listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open. Provide your medical history, drug allergies, list any previous surgeries, medications, diet pills, vitamins and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some tips that may help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your liposuction and for 1 week after surgery. Drink lots of water in the days leading up to your liposuction. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first 24 hours. Fill your prescriptions prior to surgery and place them within easy reach of where you will be resting. Place plenty of pillows, a spare compression garment, and hand towels for drainage nearby. Recovery. You should expect some bruising, swelling, and pain after your procedure. If you feel like you've lost sensation in the areas treated, don't be alarmed. As your nerves begin to regenerate, feeling and sensation should return to normal. Swelling may linger for as long as several months. Pain medication will be prescribed to control any discomfort. However, if you begin to have severe pain, contact us immediately. The recovery process is different for everyone, but within a day after your liposuction, you should be up and walking around. Excess tumescent fluid will most likely drain from the access points for the first day or two, and you may even experience a little bleeding. Depending on the number of areas treated, you may need to be out of work and away from your usual activities for the first week. Over the next 2 or 3 weeks, your treated areas may remain very sensitive and strenuous physical activities should be limited. You will also need to wear a special compression garment for up to a month to help ensure a good contour to your treated areas. Following this period, you may gradually return to activities such as lifting, exercise, and sex. Avoid any high-impact activities for about 1 month. In particular, you should avoid jogging and bouncing activities for up to 6 weeks. These precautions will help you avoid stress to your treated areas and allow time for your tissue to heal and recover. All liposuction procedures are performed using small incisions, about the width of your smallest finger, so any scarring will be minimal. The results of your liposuction are usually best seen after several weeks. Your treated areas should retain their sculpted appearance for as long as you remain the same weight. If you gain weight, you will usually gain it in a generalized fashion in areas other than those that were liposuctioned. What are the risks of liposuction? This information is not intended to frighten you, but to help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Though liposuction surgeries are a well-established surgical procedure, there are risks of complications. Just as in any operation, bleeding, infection, and scar formation can occur. Other possible complications include fat and blood clots, rippling or loose skin, and uneven or asymmetrical contour. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your liposuction, a surgery date will be scheduled. Prior to surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve